My name is Bethany Jacobsen. I'm a physical therapist and athletic trainer. I worked at a different facility for about 7 years and decided that I wanted something new. And Agape is a place that kind of feels like home. It's not like a clinical, hospital site place. You come here and it's like you're at your house. It's a really comfortable family type environment. So it was a great fit for me, and that's kind of how I ended up here. Any students that want to do observation here, whether it's high school students, college students looking to do physical therapy, or students that are in physical therapy or the PTA programs, I'm the one that sets up all of those clinical observations or internships. I feel like Agape helps educate students first through the observation program. You can come in and actually see what we do one-on-one, see what the patients are going through. We have lots of therapists here, so you can see lots of different variety of things. And then the students are actually doing internships, get to practice their hands-on skills here. The students that have a lot of experience get to basically treat patients with direct supervision. They get to do all of the work themselves, along with doing all the paperwork themselves as well. We have lots of students that will do observation here, and then if they do go on to a therapy program, a lot of times they do end up coming back here. They love our environment. They like the fact that we are a smaller facility, so it's not so big and scary, and they love the kinds of patients that we get here. Relationships that I have with my patients, I find that they go home with me at night in my head, and I'm always thinking about what the next thing is that I want to do with them. I find that I become friends with my patients outside of the clinic when they're all done. I really feel like I get invested not only in why they're here for therapy, but in their life outside of the clinic. The same thing with my students. I've become friends with lots of my students. I will go out to dinner with them, after they're all said and done, and we keep in contact. So I really enjoy students. Not only do they keep me on my toes here in the clinic, but I've had a lot of friendships outside of the clinic as well. Agape is different, first of all, because it's completely locally, owned and operated, and it's not a chain. You're not going to find us anywhere other than in this community. We're really focused on the people in the community, and I think we're really good at trying to make everything very personal to the patients themselves. We're not following a cookbook protocol on every single person. Everybody gets the one-on-one specific treatment that they need, and I also think something that's great about Agape is the variety of therapists that we have here. We're really collaborative, so if a patient ends up on my schedule and they're maybe not appropriate for me, but I know that they would do better with somebody else, we're really good at collaborating and passing people on to the right person for the right fit.